Good morning, everyone. My name is Marie-Claire Henry, and I'm a Senior Market Advisor for Enterprise Ireland, leading on the healthcare and life science sectors here in the UK. Just very quickly, for anyone that doesn't know, Enterprise Ireland is the Irish government agency responsible for trade, development and innovation. We work very closely in partnership with Irish businesses to help them start, grow, innovate and win export sales in global markets. We're based in around 40 locations around the world, with 2 offices here in the UK, one in Manchester and one here in London. Now, I'm very mindful that many of our companies that we work with are startups, or at least at that very early stage of exporting. And that means that your resources are quite often stretched, both in terms of time and money. And so for that reason, I really can't impress upon you enough the importance of having a very clearly defined sales plan and export strategy. As we all know, healthcare systems are complex. They differ across geographical regions. And in terms of that complexity, not least here in the UK, where we have both a national healthcare system as well as 4 devolved regions. So in terms of 4 devolved regions, it is complex, but that can also offer you a lot of opportunity. And I suppose my key message to you today is being prepared. So doing your market research, really understanding the competitive landscape in the market, procurement processes, care pathways, and I suppose really undertaking that in-depth research from the outset, understanding your USP, and I suppose more importantly, really understanding the challenges that are facing the potential customers that you're targeting and how your solution can potentially benefit them, both in terms of improved patient outcomes and potentially improved cost efficiencies within the healthcare system. I know many of you quite often are looking at multiple markets, and so those that are, I would very much encourage you to assess the opportunity and to prioritise. Otherwise, you find yourself very stretched really quite quickly. So today's webinar, we're going to take a look at the private healthcare sector in the UK. Thank you to Martin Bell, who will be delivering the session today. I think most of you know Martin, as he's been working with us for a number of years as a trusted advisor, along with a network of expert associates under the Martin Bell partnership. Martin's an independent consultant specialising in healthcare IT, and general strategic and practical business support. His expertise covers the NHS, private healthcare and commercial sector IT. Martin's experienced in working with companies at all stages of growth, both scale-ups and startups, as well as with established clinical and non-clinical systems vendors, providing both market analysis and investor advice in the digital health technology space. Martin's an experienced former board-level CIO in the NHS and also former Deputy Managing Director of EMIS, the UK's clinical systems provider. I'm delighted to say we're joined today for expert insight by James Maunder. James is CEO at the London Clinic, a leading private charitable hospital here in London. Prior to this, James was Director of IT at Oxford University Press, and prior to that, the Institute of Directors. James has significant international experience delivering sustainable business transformation. So thank you both very much for taking the time to be here with us today and sharing your advice to our client companies. Some very quick housekeeping before I hand across to Martin. So we've allowed around an hour today for the entire webinar. The first half, Martin will be looking at detailing an overview of the private healthcare sector, and the second half will be an opportunity for you to pose questions to both Martin and James. Now, you probably will be delighted to hear you won't hear from me too much more again today, as my colleague Peter Wade will be doing the wrap up at the end. But just thank you to all of our client companies for joining us today. Any questions about the UK in terms of the healthcare sector or the life sciences sector, please don't hesitate to get in touch with either myself or Peter at any time, and our contact details will be shared at the end of the webinar. And so without further ado, I would like to hand across to Martin to kick off the session. Thanks, Martin.
Thank you, Mary-Claire. Good morning, everyone. Hope you're all well. Hope you've got your favourite coffee or cup of tea or something stronger, perhaps, depending on your time zone. One thing I can assure you is that no Facebook engineers have been anywhere near the Enterprise Ireland network over the past 24 hours. So hopefully we'll have a smooth 55 minutes ahead of us. This session, just to be clear, it's very much focused on private healthcare. As you'll see, private healthcare in the UK is quite diverse. There's quite a lot of it. Obvious point, silly point perhaps, but there is. We're not going to particularly cover NHS. They are covered in other webinars, will be again, have been before. But obviously there is some synergy. The other thing I hope is that whilst this is focused on Irish companies, Enterprise Ireland clients, companies based in Ireland, looking to come to or grow in the UK, hopefully for those on the call who are not part of, not from Ireland, hopefully again there'll be quite a lot of applicability. And again, really looking forward to the questions we have found in this webinar series. This is the 4th or 5th in the webinar series over the past 12 months. Allowing a good chunk of time for your questions is good. The harder the better. Myself and James are looking forward to answering whatever questions you have in the second half of the hour. So let's just, we're going to go through the various areas. Let's just start with a very high level overview. So in the United Kingdom, this is UK data, total healthcare expenditure, and we're talking healthcare here, not care, I've got a slide on that separately, is 270 billion per annum, 270 billion pounds. Now, over 80% of that, about 82, 83%, I think, is government financed, and that then feeds through mainly, obviously, into the NHS in the 4 devolved nations, England, Scotland, Wales, Northern Ireland, as well as obviously things like public health, other central spending. We then have in the region of a 50 billion total private healthcare sector, which is funded in a variety of ways. Now, to put into a little bit of context, the UK private healthcare market in totality is about twice the size of the whole Irish healthcare market and spending that takes place over there. Government spending in Ireland as a percentage is about 10 percentage points lower, just over 70%. Not to forget, just to include, but it's not part of this specifically, but if we're looking at health and care as opposed to healthcare, just worth touching on 16 billion residential care home market, 7.3 billion domiciliary care market, 8 billion children's social care market, and a 7.5 billion is actually spent on social care for working age adults. It's often the case when we discuss care, we've had it recently with the somewhat non-event of the government saying they're going to fix social care and then basically giving all the money to the NHS. The care often focuses on the elderly. There is a huge care spend that is not involved with the elderly. Now, I mentioned this, and there's a couple of other markets in here. I mentioned this because the totality of this spending in terms of opportunity, whether that's to actually deliver clinical or care services, whether that's to provide services to those companies delivering them, whether that's software, medical devices, other forms of technology, professional services, back office functions. There is huge scope in what I think is a very large market to provide into this space. Some of the other markets in terms of private provision, there is a relatively active, I'm going to say largely in London, but some other major cities as well, relatively active private GP market in the traditional sense. We'll come on to the digital health, the doctor on demand markets in a bit. There's a very active dental market, and it's split about 50-50 between public and NHS provision. It's a market, again, that is very under-resourced in terms of NHS provision, not a market that's really been focused on in terms of where NHS funding has gone. And in many areas of the country, you can only get private dental care. Opticians, again, not to forget those. We've got a whole range of independent practitioners Individually small, but collectively quite large. There's something like, I think, 60,000 members of the British Association of Counsellors and Psychologists. There's, I don't know, 50, 60,000 members of the independent physio body. So quite a large number of people. Now, they may not necessarily, some will do full-time as independent practitioners, some will do, some work in the NHS, some work for private providers, some work freelance themselves. So quite a mix, but there is quite a large market. And again, another one that's often forgotten when we're talking about private healthcare. We've then got the digital health services that have come to the fore during COVID. Data harder to get on these. In the private sector alone, I've got a slide later, you kind of lose the will to live on about page 3 of Google, trying to find all of the doctor on demand services that are actually available. There's a lot of them. It's an immensely crowded space. People are starting to carve out certain niches. There's starting to be certain subsectors. Estimates from the Digital Health Market Report published by Languison estimates this market at the moment at about 250, but that's probably up. That's probably doubled from before COVID. We then obviously got things like diagnostics and pathology, and then also, let's not forget pharmacy, big over the counter as well. Obviously lots of aspirin, paracetamol, Nurofen are the biggest spender, but 11 billion again spent with pharmacies, exclusive of things like NHS prescriptions. Now, we've seen in the UK a huge rise in waiting lists in the NHS. Driven by COVID, driven by the step down in activity to handle COVID, not enough staff, burnout of workforce, whole underfunding, historic underfunding. Interestingly, the waiting lists were pretty high and have been growing since 2010, before COVID struck. COVID, if you like, has perhaps pushed things over the edge. Bad in the physical health world, bad in the mental health world. Perhaps to some extent even worse in the mental health world, because actually the targets and the management of that area was quite poor, very underfunded in terms of mental health services. There is, and I'll just make this point as it is a private healthcare webinar, literally landed on my desk yesterday from the excellent Healthcare Markets magazine, and anyone who's interested in private healthcare should subscribe to that. Survey done literally in the past month. More than 20% of adults have felt the need to access some form of private healthcare, despite the high ratings, high love, in quotes, it's the nearest thing we have to a national religion, unquote. A quarter of those polled said that the wait for treatment for themselves or loved ones had had a serious impact on their mental health. Young women, interestingly, particularly 45% of women aged between 18 and 34 felt that the NHS had been quite dismissive of their needs. And similarly with ethnic minorities, 22% again had experienced racism and other forms of discriminatory behaviour during their dealings with the NHS. So I suppose the point being is that whilst it's certainly great, and I'm a great advocate of having a universally funded healthcare system, it's not likely that private healthcare is going to go away anytime soon. And if we actually look at government policy, if we look at the fact that we do have a Conservative government, have had for 11 years now, we'll have for at least another 4 or 5, potentially for another decade, then actually the drift to an increase in private provision, whether that's because of pressures on the NHS, and therefore those that can afford to pay do, or whether that's down to a change in market forces and market format, then I think that we can see some of that coming through. Private acute hospitals over the past 18 months have had a particularly difficult time. They have had a reduction overall in their income. Some have done well, some less. Many got a significant amount of funding from the government to help out the NHS. Some controversy about the fact that some of those organisations didn't necessarily do very many operations or treatments, but that's a different issue. But already signs of especially self-pay, so different private healthcare organisations, and I'm going to put up some of the top private healthcare organisations in a moment, often have a different mix of how they do the types of revenue streams that they have. Some rely more on NHS overflow work, some rely more on private medical insurance work, some rely more on self-pay. Certainly, again, from a lot of the articles floating around at the moment, there's been quite a bounce in self-pay as people have decided that they cannot wait on NHS waiting lists. Private mental health, a little under 2 billion. Now you'll see there that nearly all of it, 80–90% of it, is commissioned by the NHS. I'm going to do these slides in reverse order, actually, having talked about mental health. So mental health, an area, as I said, in terms of public provision in the UK, heavily underfunded, and a massive reduction in the number of beds available within the NHS. And that has driven a huge rise in private provision. But it's private provision, typically under an NHS badge. In the acute sector, slightly different split. Overall, and this does vary by hospital and hospital group, overall around 40% of private acute treatments come through some form of private medical insurance, a little under 30% from the NHS, and up until now about 20% from self-pay. I'm predicting that we will see an increase in that self-pay. We may also see an increase in NHS because, again, there are funds available to commission private hospitals to help out their local NHS hospitals. Although the numbers overall, as you can see there from some of the facilities, are far smaller, 8,500 independent sector acute beds versus 160,000 in the NHS. These are sizable numbers. And if you are a company that's looking to provide clinical systems, electronic patient records, document management, electronic prescribing, digital patient-facing services platforms, medical devices, all different kinds of machines that go ping, back office functions, software for HR, legal, finance, professional services, transformational change services, whatever it is that you're delivering, these are quite significant markets and just show the volumetrics of what you're getting into. Also worth noting that of the 262 inpatient private acute facilities that we have in the UK, 69 of those are actually run by the NHS. And in fact, there's one or two NHS trusts that earn as much or more from their private work as they do from their NHS work. So these are some of the top private acute groups. This full list would actually go on for 4 or 5 slides in this font. So I've just kind of cut the top slice. You can see at the top there are some big groups, and there's been quite a lot of mergers and acquisitions activity. So this is taken from a certain date and time. Some of the groups may have changed hands since. There's some big groups at the top: BMI, now Circle, Spire, Ramsay, Nuffield. The beds in the thousands, the hospitals in the dozens. You then come down essentially through smaller groups, and the carry-on for this list is essentially a series of individual independent hospitals, with typically in the region of 30 to 50 beds. So quite a lot of organisations in terms of engagement that companies looking to get into the UK can go and talk to. Similar position in private health, and this is a fuller list. Apologies for the font, but you can have copies of these slides, and it's all recorded. Again, Priory, Signet, Elysium, St Andrews, big numbers of beds, large numbers of facilities, 4 seasons as well in that camp. And then you come down and down and down. Now, if you go down the list in mental health, you tend to get in some cases into more specialist areas. They may deal with particular mental health treatments. They may focus on certain conditions and not others. In some respect, that's also true back on this private acute list. If we go down and down and down, then you start to get into those that perhaps only deal with certain types of plastic surgery, or maybe only deal with cataracts. So again, there's quite a wide range of how private, the main private healthcare, acute mental health, is delivered. Mentioned earlier quite a lot of mergers and acquisitions activity, and in fact in 2020 M&A activity in private health reached a 5-year high. Now whether that's because COVID made certain groups attractive because they were struggling, whether there was just the feeling that more private provision overall in terms of UK healthcare is coming, perhaps a combination of those things. But certainly lots and lots of activity. I've literally picked a few here. There are loads, and there's merger and acquisition activity every month. So quite an active market, and of course, depending on what business you're in, whether it's more frontline provision or whether indeed it's software solutions, services to support that frontline delivery. If we flip to digital health, one of the ways, and I know Mary Claire talked earlier about many of the Irish companies that Enterprise Ireland work with are startups or early stage growth. Not all, and indeed some with large backing. Of course, acquisition could be another route into the UK market. We've literally had, and I've picked again some slightly variant examples here. You know, we've got the Co-op getting into digital health. Only this week or last week, we've now got Asda signing a partnership with Zava to get into digital health. We've got some of the big players like Teladoc, Health Hero, and then in some of the more specific sectors like dental, companies like Agilio have been pulling together a portfolio of offerings, again in the back office space, for both dental, to some extent opticians, and also now significantly primary care. Whilst we're on this slide, just to address the point, and I mentioned it earlier, there is a lot of talk about the privatisation of the NHS. And in some respects, the current government knows that it would be completely ludicrous to actually go off and try and privatise the NHS, because it would actually attack in the main, the core group that votes for the current government. But there is certainly concern, I think, in the NHS ecosystem around obvious and continued underfunding, not enough money. There's certainly concern around the rise of integrated care systems in England, some of which are starting to include private healthcare organisations, excuse me, which does make sense in terms of local delivery, harder in terms of some of the large US companies, US private healthcare companies that are backing them. So I think we're going to be in for an interesting period in private health over the next decade, both in terms of finally private health really getting into and adopting digital health technologies, but also how much, if there is indeed a shift from either straight NHS provision or at least private delivery from NHS provision, and of course pure private. In the cancer space alone, at the moment there is a prediction that the cancer backlog waiting list could take a decade to clear, if not more seriously addressed than it has been. We're already starting to see big players in that cancer private space like Rutherford delivering NHS services through the Community Hubs initiative. So there's quite a synergy and a flow, not just of the staff working in these different sectors, but also in terms of the services that are delivered. So just focusing on the digital health aspect, we have seen everywhere, private healthcare we're talking about here, an explosion in the use of technology during the pandemic. it's tripped over perhaps some of the barriers, the blockers that existed previously. It had to be the case. Things that existed have been picked up and used far more. Things that didn't exist have been introduced. The extent, however, of usage, still quite variable, still a lot of it, still some of it defined by age or other demographics, some of it more successful than others. And one of the things that is starting to emerge, I think if 2019, I'm going to call the year of the long-term conditions app. You know, there was a diabetes app or a CAPD app coming out almost every other week. 2020 was obviously the year of video consultations, online consultations, direct patient-facing services. Certainly one of the big growth areas that we're seeing at the moment is in digital mental health services. Some already out there and delivering both privately and publicly. Many more starting to come through, seeking funding rounds, developing tools in that digital mental health space because of perhaps the even more significant problems in the mental health space. Some focused on children, some focused on adults, some focused on all, but really quite an interesting space to watch at the moment. And a little shout out as well, I suppose, just picking up on one of the things that James, who will be on in the Q&A session, that actually it's not just the front end stuff. It's also the fact that private healthcare, they need networks, they need data centers, they need to have digitized documentation so they're not swamped with paper. There is a support systems and support services infrastructure that is significant across the delivery of private healthcare in all those different sectors that we talk about, just as you will find that in public health delivery. So literally just randomly pulled a bunch of slides across different kind of digital health services that are out there in the private sector. People know about Babylon, but there are many Babylons: Doctor Care Anywhere, Medic Spot, Push Data, DocTap, Livy, Doctor on Demand services. And interestingly, it is still mainly Doctor on Demand, and I would say that many private providers are really missing a trick by not pushing more, and I'm seeing some evidence of this starting to come through, but pushing more on nurse-led services, physio services, OTs, speech and language, other areas of the market where actually the same model works, and in some respects the cost of provision is cheaper. Been a huge rise in terms of online pharmacies, Pharmacy to You, Echo as a couple, men's health, Newman, and also in mental health with, again, more digital on demand platforms like Priory Connect. We saw Kooth, which is mainly aimed at, well, is solely aimed at child and adolescent mental health on the previous slide. So lots of these solutions in all sorts of areas, and there is a phenomenal list, and we're not going to be able to cover it in the time that we've got today. So before we got to today, I asked James for a few of his thoughts, and these may be some areas that you'd like to probe him on, not setting him up for complex questions, but just perhaps suggesting these might be some areas. So some of James's thoughts around the challenges of developing a future fit culture, not only in IT, but across the healthcare organisation. This is true of all organisations, really, not just in healthcare, that we need people who are digitally savvy, that they get the fact that how change happens and how to feel part of that change, how to be involved in that change, that people can change quickly, can adapt. These are challenges that all healthcare providers face. Delivering an interoperable, flexible, scalable, secure technology architecture in our instant gratification culture society. This is something often I describe as being things that are above the line and below the line. You deliver things that are above the line, everyone sees them, but actually a bit like ensuring the electricity supply to your house or the foundations to your office building are secure first, you need to make sure that you're not building those above the line things that are going to give that instant gratification on shaky foundations. Renewing legacy while innovating, and as we just talked about, getting those foundations right, hosting, cybersecurity. Now, again, not to dwell on it, but you know, if a mega organization with effectively unlimited money and more money than most of the 200 odd countries in the world can have a total global outage for an entire evening, such that nobody yesterday got to see a picture of my dinner, then smaller organizations, private or public, this is a challenge to ensure that things are secure, safe, and we're not just talking about pictures of my dinner here, we're talking about patient data. And patient data holds that special place in terms of not being leaked, not being shared, and being completely secure. So a few closing thoughts then before we get into the Q&A. Yes, it's true that the UK does have, perhaps more than many other countries, a significant public focus on spending through the NHS, through universal healthcare provision. But at a bottom end estimate, and based on actual ONS data, 50 billion spent on private healthcare. In addition to that, as I mentioned, some of the allied markets as well, and indeed in the care space, it's estimated that around 50 plus billion of care provision is delivered by friends and family. So again, opportunities for companies to support families in delivering care that isn't provided either privately or by the state. Digital health services have been hugely spurred on during COVID. I think there'll be more of that. That's like the most obvious comment in the world. But I think there'll be more of it that's not doctor-led. And I think we're going to see an explosion in the next 2 or 3 years in the digital mental health space, particularly. UK waiting lists are high. I think this will, I think it already is, driving private sector healthcare, especially for acute. I think the self-pay increases that we're seeing already will continue, and it'll be very interesting to revisit some of these statistics year on year, again, over the next 2 or 3 years. Although not always the case, procurement cycles in the private sector can be shorter. Now, by shorter, that might mean it's 6 to 9 months rather than 12 to 18 months. It might be it's 3 to 6 rather than 6 to 9. But a lot of private healthcare procurements can be shorter. That's not to say that there won't be processes, because there often is. And certainly for those private healthcare organisations with charitable status, then they obviously have an obligation under their trusteeship to run a fair and transparent process. And I suppose the final point is there are a huge number of providers across the private health market, from large hospital groups like the likes of Circle and Spire, to small online GP providers, networks of independent practitioners, dental chains, optician chains, independent opticians, pharmacy chains, independent, some blending the brick and click. Most even local pharmacy chains will have, some online presence in many cases. Will do, they've done door to home deliveries for years. So both the physical, technological, but also the service, solution, device, product, however you want to find opportunities, are really quite significant in the private healthcare space in the UK. Here's a few sources, just so you didn't think I entirely made it up, which you might also want to check out if you are seeking to come to the UK and look at private healthcare, or indeed any other health and care sector, to be fair. And I've nicely, I believe, finished almost exactly on my spot time.
Thank you, Martin. Thanks, Martin. That was very informative. And we'll now invite Martin and James to please turn on their cameras, please. And we'll move into the question and answer section of the webinar. So just a quick reminder, please do use the questions tab on the right-hand side of your screen and make the best use of James and Martin's time today. So we've already got a few questions in, so I'll just get to them now. So the first question is just appearing on my screen now. The first question is related to sustainability, and it says the NHS has stringent carbon targets. Is sustainability something private care considers when working with suppliers? James, I might go to you on that.
Well, the short answer is yes. I had a very interesting session with Gartner, really looking at sustainability in healthcare and how carbon's likely to be calculated, counted, carbon budgets, carbon allowances. So I think it's early days, but it's something which is definitely rising up the priority list and something which could be a real marker of distinctiveness, actually.
Yeah, can I just add to that, Peter, if I may, that Joe's absolutely correct. That don't forget, private organisations have their corporate and social responsibility obligations. Is the first thing. So there is some sort of legal or accountability element there they need to report on. The second thing is that actually many of their customers are very concerned about sustainability. Not all, I grant you, but many are. So from a reputational, from a branding, from being perceived to do the right thing, then sustainability, I think, is as important in the private sector as it is in the NHS.
Brilliant. Thanks, Martin. Thanks, James. So the next question is, I'll probably go to you again, James. Are you seeing private health providers using the same digital health vendors as the NHS, or new favourites emerging?
Oh gosh, that's an interesting question. Boring answer is that it's probably a blend. Certainly, I don't make any distinction. We don't make any distinction between organisations which the NHS. Sorry, there's a fair bit of noise on the line, but oh, thank you, whoever. There's a fair bit of we don't make a distinction. The key point for us is does the supplier meet our needs? And clearly there are some distinct needs in the private healthcare market as opposed to the NHS, but they're subtle. I think the key distinguishing point for me is around, do suppliers want long-term strategic relationship or not? There's an awful lot of I was just having a look at my inbox actually earlier today. There's an awful lot of sort of firing out of marketing messages to try and sort of get a little bit of business without actually getting to know me or us at the London Clinic. In my inbox this morning, I had 15 unsolicited sales emails. If I even bothered to look at those, I wouldn't have any time to do my job. So the likelihood of that kind of engagement having success is very, very low. And where I think we're looking to go is a smaller number of really strategic partners rather than suppliers. And and organisations who can really sound out our needs and respond to those needs will be in a really great place to work with us in a mutually beneficial partnership. Whether it's the main focus on the NHS or on private is incidental, really.
Yeah, I completely agree with what James said there. I think from a market perspective, then the answer is literally the blindingly obvious. There are some that just focus on private, there are some that just focus on the NHS, there are some that do both, and that will continue. On the engagement point, actually, one thing I'm going to say is that certainly companies looking to engage, James absolutely right, all that he said there. Certainly what I recommend is a far more useful tactic, at the very least, is to get along to one of the private healthcare conferences that's run and actually talk to people, actually talk to CXOs of various X description, listen to the problems, go to the talks, hear what they've got to say, hear what the challenges are, hear what the successes are to date, and engage with people over coffee and maybe the odd glass of champagne, and actually understand what their challenges are. Certainly unsolicited emails and other messages are going to hit the rock, as James has said.
Brilliant, thanks guys. Martin, I might go to you with this question first. Is it important to have traction in Ireland before approaching the UK?
Sorry, can you say that again, Peter?
Is it important to have traction in Ireland before approaching the UK?
So I think the point is more about traction than Ireland. If you have traction in another healthcare market, such that you have proven your solution, service, whatever it might be, then that has to stand you in some stead in terms of then going to a new market, and indeed not just the UK, but any other new markets. In terms of the UK, then yes, the fact that you've got something proofed in Ireland is going to be positive. I think the specific question on Ireland is that there's obviously long-standing relations. There's an affinity. The fact that you've got something working in a hospital or some other facility in Ireland will stand you in good stead here. But at the end of the day, the UK, whether it's private or public, whether it's Scotland, Wales, Northern Ireland, England, regions of England, it can be quite parochial. So I think having a proven solution in Ireland, great, but it's more about having a proven thing, and the key thing then is to get that early UK-based advocate, private hospital, dental clinic, whoever it might be, whatever part of the private healthcare ecosystem you're getting into, to then really push that UK base. But obviously, of course, you need to use the collateral, the experience, the evidence, the research, whatever it is that you've got from your home country in Ireland.
Thanks, Martin. James, would you like to add on that?
Yeah, I agree completely. I think, when I think about the reference calls that I have, many of them are with the NHS because we seek to learn from the NHS. There's some really excellent work being done there. Many of them are international, and we're in conversation with, well, in fact, our infrastructure is hosted, supported and maintained by an Irish organisation, Arcfire. I was talking with an Australian hospital last week around what they're doing with Microsoft. So, I think we look for the references where we get them, and I agree with Martin. I think it's important to show a track record, and if you haven't got a track record, to be open and honest about the fact that there isn't a track record, but there is an opportunity to collaborate and innovate and explore. One of the key mistakes, personally, I think, that tech vendors make is too many tech vendors tell you what they want to sell you. Here's a new cybersecurity thing that I want to sell you, and I think I've got a lot of cybersecurity things. My head of cybersecurity tells me we don't need any more cybersecurity things. And I'm a great fan of Simon Sinek, and he wrote a book called Start With Why. Tell me why I should engage with you as an organisation. Tell me what what are you going to do for my organisation? Don't tell me what you want. Don't start with what you want to sell me. Start with why we should engage, and that's a really good way then of looking at potential mutual opportunities to collaborate.
Thanks, James. That was really insightful. So I might go back to you, James, again. So to what extent is research, including research and development, carried out in the UK private healthcare and/or care markets?
Oh gosh, I might rely on Martin's more in-depth knowledge of the UK private healthcare market for this one. I mean, talking about the London Clinic, we do research. We are a charitable organisation, and part of that charitable purpose funds research and funds other charitable pieces. Certainly, I have an aspiration, and at the moment it's an aspiration, and this is one of the challenges that Martin mentioned earlier, to have a constant stream of technical innovation within the hospital, true technical innovation, not sort of just replacing one big old system with another. But getting that kind of innovation hub, that innovation ward, that innovation floor within the hospital up and running is easier said than done. Martin, what would you sort of add to that?
Yeah, no, I would agree. To answer the question specifically, yes, there is a huge amount of research and development that's done both in and by the private sector. That ranges from certain individual private providers who are doing research and innovation in terms of new treatments, medical devices. We didn't really touch on, because I sort of largely excluded it, but we briefly mentioned that pharmaceuticals, you know, almost entirely privately funded. There's often a lot of cooperation work. So as James has said, you know, crossover between private and NHS and some of the academic health sciences networks and other bodies. Some of the golden triangle of, you know, London, Oxford, Cambridge getting involved in that research, golden quadrangle, including Manchester now. And so, but I don't have the numbers to hand, but there is a huge amount of private research and development. How it stacks up against the public, not sure, because I don't have those numbers, but it's massively significant.
Thanks, Martin. Thanks, James. So we've quite a long question now. I'll just read it out. So we are a digital health platform and have a proven remote monitoring and nutrition, lifestyle and behaviour. We have also built a customized dashboard and decision support system to help users, clinicians and coaches for helping in physical and mental health. But we are not a medical device yet. How do we work in the UK for POCs and ultimately bigger rollout? We see many grants being offered for healthy aging and prevention of chronic diseases, but don't know where and how to start.
Would you like to pick up that, Peter? Peter?
James or Martin, over to you for that question if you want to answer that.
Shall I go first, James, and then you can?
Yeah, go on, you go, and I'll add any build.
So very long question. I think it sounds like you've got a platform that can support nutrition, mental health, I think was mentioned. If we're looking at the private sector, there's no barrier to you bringing that here. If you're looking at the UK, obviously I don't know the detail, but it may well be that your device doesn't need to be registered as a medical device. That's entirely subject to, I don't know what the thing is, but I see many digital platforms, and very few of them actually need to be registered as medical devices. The key thing that I think I'd advise you to do is, and I'm not saying this because I'm now these days a consultant, but you need to get some expert advice. You need to get somebody in the UK who understands the UK market, who can understand what your thing is and then point you in the right direction. Now, the grants, I think you're talking about some of the Innovate UK SBRI grants that are out at the moment. They can be a good place to start, although whisper it quietly. No one from Innovate UK is on the call, but they can be a right pain to get. And the scoring can be a bit scatty at times. Shh, don't tell anyone I said that. So whether that's the right source of funding, I think depends on the solution. But I think certainly from what you've said, there's no reason why your solution shouldn't be successful. It's certainly the way that you know many clinical services are increasingly being delivered. Certainly from that digital mental health space, that is a very active market, both in terms of usage and increasingly in terms of some organisations being very well funded as well.
Brilliant, thanks, Martin. So our next question is, would you like to build on that, James?
Yeah, just a thought coming at that question from the perspective of someone who would be potentially procuring that kind of platform. I think one of my biggest challenges is in contextualizing kind of opportunity. And so I think one of the things that it would be incredibly helpful and useful for you to do is to think through, okay, for an organisation like the London Clinic or whatever you decide your target organisations are, where might your platform fit in terms of an overall solution architecture? It doesn't need to be in huge amounts of detail. Where would it fit? And then thinking about the interoperability and the digitisation and the data flows. How would it need to plug into and augment what's already there, or what the organisation is trying to build out, such that it becomes integral component part of the solution, and it doesn't become part of the problem, which is a standalone thing that doesn't quite fit and nobody's quite sure what it's going to do. And one of the, actually, this is my biggest complaint with cybersecurity providers, actually. Providers tend to be very bad at explaining where their solution fits and why. They're very good at telling you you need it, but very bad at saying, well, where does it fit? And where might you already have a bit of overlap there that you've then got to make a conscious decision around? Do you accept the overlap or not?
Brilliant. Thanks, James. Thanks, Martin. So our next question relates to software governance laws. So what is the thoughts on medical device software governance laws in the UK against the EU standards, laws, rules going forward?
Well, would you like to go first, James, or do you want me to?
I'll tell you what, I'll go first. I'll pin my political colours to the mast as well a bit, because I like getting on the soapbox. It gives me no pleasure to say that I think our laws will undoubtedly diverge. There's certainly a lot of noise around data governance laws diverging. So GDPR, even though the UK helped shape and form GDPR, it does look as though the tide is shifting towards a freer market for data. What that will mean for us as hospitals, none of us yet know, I think. What it will mean for us as individuals and our information rights, we don't yet know. But certainly with the current, as Martin said, we've undoubtedly got another 3, 4, 5 years of the current political flavour in the UK, and it could well be a decade or more. So I think the tide is definitely for divergence from the EU at the current time.
I think on the politics front, James and I might be of similar shades. Just in terms of a couple of things. So I think if you stand back and look at the macro piece of the UK, whatever else Brexit has delivered, it's delivered in the minds of certainly the current government and their supporters. This idea that when we were part of the European Union, we were all constrained and we were all stopped. We all know that's not true. We could have had blue passports forever. Croatia has. We could have had, nothing. We could have had proper immigration controls. Most countries did. We chose not to. All the things that were the Brexit lies. Okay, so we've done that. We are where we are. On the medical device front, I think it's important to bear in mind that it's just going to become more complex. I think we'll end up with the EU standard, we'll end up with the GB standard, and remember that the Northern Ireland standard is then different again. So you could well end up with 3 different classifications, registrations, accreditations that you need to go through, depending on which particular market you're operating in. I think James is absolutely right. If you again go back to the Ernst & Young report, 2019, I think, possibly 2018, it reckoned that the value of the NHS data alone, pick a number for the private healthcare data as well, was 10 billion per annum. So if NHS healthcare data was to be sold, it was worth 10 billion per annum. Now, I personally think that's an enormous undervaluation. If I was even that way persuaded and Google came to me and said, can we have all of your NHS data? I'd go, sure, let's make that 500 billion, because you're going to go off on an absolute fortune from it. I don't actually support doing that, but that is obviously the direction of travel. Loosening GDPR is one of the things that facilitates that. I suspect it will be dressed up. You know, we had 3 different AI strategies come out last week. Well, one was from the government, one was from the NHS, one was from somewhere else that I can't remember. So I think it will be probably about making the UK an AI powerhouse. To do that, you need the healthcare data if you're looking at the healthcare sector. And to do that, you need to loosen the rules and make it more liberal in terms of data sharing.
Brilliant, thanks Martin. So I see we have 5 minutes left, so we'll try to get to as many questions as we can. And if we don't get to your question during the time, we'll make sure to follow up with you afterwards. So our next question is specifically for James. So great webinar, guys. Does your digital transformation strategy influence the people you hire, or do the people you hire dictate your digital strategy? In other words, do you come into the role of CIO with a clear idea of how to digitally transform, or has your strategy been shaped by the people around you?
That's a really, really good question, and it's going to be very difficult to answer it briefly, but I'll do my best. I think one influences the other. I think my role as CIO is to create an environment in which diverse people can bring all their strengths to work. So one of the things that we need more and more, I think, is we need innovation and creativity. We need agility. People talk about the world being VUCA. I'll see if I can remember what that means: volatile, uncertain, complex, and ambiguous. And you can only navigate through that if you have people who are really talented, show great agility, are innovative and creative. And to do that, we need as diverse a workforce as possible, and that's diverse in terms of lived experience and perspective. So I think my role is to create that kind of environment and then hire in people who reflect and extend that environment and share those values. What I have done at the London Clinic is recruited in a very talented architect and strategist, so that we have leadership around architecture and strategy, because it's complex thinking our way out of a very legacy environment and try to imagine what a digitized future hospital might be. I think then our challenge is around extending that mindset leadership across the hospital. I think one of our biggest barriers, interestingly, to digitizing at the London Clinic, and I imagine it's similar in many hospitals, is the lack of digital skills on the wards and with our nursing teams. You know, these are people who focus on looking after people and making them better, making them feel good. They're not worried and frankly often quite scared by technology. So it's about, you know, we have to be able to spread those skills and knowledge and capabilities across the organisation. But that was a very brief answer to a really fascinating subject. You could spend a whole hour on that subject, if not more.
Absolutely, thanks a million, James. So our next question, I might get 2 more in possibly. Has COVID advanced the market opportunity and expenditure on private, on preventative care pathways?
Sorry, you say that question again?
Has COVID advanced the market opportunity and expenditure on preventative care pathways?
Well, the short answer to that is no. And in fact, there was an article out this morning that was very specifically about preventative care pathways and shows that the government's effectively cutting them. So from a public perspective, which is where a significant amount of preventative stuff happens, no. In terms of private provision, I can't say whether it's accelerated it. Those people who have, for example, corporate plans, and you know, for example, they might, you know, have a plan, but have both healthcare and Nuffield Health, but maybe also, for example, Nuffield Health gym facilities, things like that. One presumes that they are carrying on doing that. I can't say that I can necessarily see an acceleration occurring.
Okay, thanks, Martin. James, do you have anything to add to that?
No, I agree completely with Martin.
Brilliant. So maybe one final question. How do wearable devices measuring motion, ECG, EMG, etc. feature in UK private healthcare? James, maybe to you first.
Well, I think very briefly it comes into that digital patient experience and comes into that kind of innovation hub piece that I was talking about. Our main focus at the moment, to be honest, is renewal. And COVID has, we achieved a lot through COVID, but it has been more of a blocker than an accelerator, in my view.
Yeah, I'll just perhaps a slightly different point to add, but relevant to the question, is what I'm starting to see, and I'm doing some work with some companies in this space at the moment, is that some of the allied technologies that are needed, so for example, some of the algorithmic predictions, some of the low battery power, low code type technologies that enable portable device for function longer without needing recharging, to enable something that previously wasn't wearable, I don't know, was desktop, but can now become wearable because actually it's now got low power, long battery life, doesn't need recharging. Some of those technologies are starting to make the next kind of leap forward. And I think the landscape might look very, very different in sort of 5 to 10 years time than what it does today.
Brilliant. Thanks, Martin. Thanks, James. So I see we're just approaching the hour there. So I might just wrap up very briefly. So Martin, if you could go to the next slide, please. So firstly, I'd just like to thank Martin Bell and James Maunder for their time this morning. That was a fascinating, just go to the last slide, Martin. Finally, we do have the Market Research Centre, which is a resource available to all Enterprise Ireland client companies. So please do get in touch with us if you would like to access any market reports. Also, I'd just like to mention that International Markets Week is coming up next week from the 11th to the 15th of October. This gives Enterprise Ireland client companies an opportunity to speak with market advisors across the globe. So if you have registered, please do feel free to send us a message on the platform, and we'd be happy to have a meeting with you next week. Finally, Med in Ireland takes place from the 3rd to the 4th of November. This is an international conference which invites international buyers to attend and meet with Irish medical device and digital health software companies. Finally, you can see our contact details on the screen. If you'd like to contact my colleague, Mary Claire, Senior Market Advisor, her email address is there and my email address is there. Finally, I'd just like to thank everyone for coming today. I hope you enjoyed the hour. If you do have any questions, feel free to drop us a message. So that just leaves me to say thank you, goodbye, and enjoy the rest of your day. Thanks, guys.
Thanks all. Bye-bye.
Bye.